Hi, Leah. My name is Elizabeth Johnson, and I'm the RDN who will be meeting with you today. So, in your paperwork, you filled out that you were interested in maybe trying a vegetarian diet. That's an awesome switch to make, and I would like to hear a little bit more about why you're doing that and stuff, and some of your concerns.
Sure. My family has a lot of history on both my mother's and father's side of cardiovascular disease as well as strokes. So I don't know a whole lot about it, but I know that consuming a lot of red meat, I think, and dairy products. What kind of fat is in those?
Trans fat,
Okay, trans fat, but isn't there another one?
saturated as well.
That's right. That's what I was thinking. So I'm trying
Okay.
to decrease my intake of saturated fat.
Okay.
So I'm trying to, decrease my dairy slowly and then my red meat intake because I really just want to kind of jump ahead of the gun and decrease my chances of developing cardiovascular symptoms. And so I just think that I eat it too often, and I would like to kind of decrease my intake until I'm at more of a vegetarian diet that maybe includes some fish here and there and eggs, but I'm not really sure. I can't remember the term. I know there's a lot of different kinds, so I'm just kind of confused on where exactly I should go with that.
Okay, so it sounds like you are starting in a great place. You're aware of what you want to change, you're aware of the risk factors in your family history, and this is an awesome place to start. You're ahead of the game by a long shot. So, from what I'm hearing, you just want to kind of start to cut out some red meat, some saturated fats and you're educated, you know that those come from dairy products. So I want you to know that this does not have to be a sudden change. Like you don't need to go cold turkey. That can be really unmanageable. So how many days a week do you feel like you're eating red meat and dairy products?
Well, I probably eat dairy products every single day, 3 times a day. I really, really like my dairy products.
Okay.
And red meat probably at least 5 days a week, 4 to 5 days a week. Um, and I do eat the red meat at home, and my mom typically prepares it, so I'm not the one cooking at home. So I just don't really know how to, have that conversation with her. That I would like to decrease the intake, not only for me but for her as well.
Okay, so it sounds like this is coming from a really good place, like you're doing it for you and your family. So please know that I don't, as a dietitian, I don't want to give foods like the healthy and unhealthy connotation. All food is great in a balanced diet. Now, for you personally, if we're going to move towards that vegetarian diet, we can slowly start to cut those foods out. But know that if you have it dairy 3 times a day, that is completely fine. So if you're having yogurt with breakfast, milk with lunch, some ice cream for dessert, that's fine. And that is part of a healthy diet. So, what are some of the fears that you have with talking to your mom and kind of getting this conversation and this ball rolling?
I just know that my family isn't too keen on switching up their diet. They kind of like to just stick to the same
Mm-hmm.
thing. So it's kind of hard to have them be as open-minded as I am. Because I really think that diet can help you prevent chronic illnesses.
Okay, and I have heard that from a lot of patients, especially when you are living with others. It can be hard to really get the diet to switch within the household. So I think since you're coming from a very educated standpoint, you want to do what's best for your family. Is this a conversation you're ready to have, or would you like the vegetarian diet to kind of be something you start slowly implementing, and once you're comfortable with, bring it to them? Or how do you see yourself going about this?
I think probably getting more comfortable with it personally first
Okay.
would probably be the best approach. That way I can be more educated when it comes to discussing it with my family members.
No, and I think that is a great place to start. If you feel educated and you feel confident, you're going to show them that you feel confident and you're feeling good about how you're eating. So, are there,
I have a question.
yes,
Sorry to interrupt.
no,
Um,
please do.
so I know that without eating as much meat, I'm concerned about getting enough protein in my diet. And I'm just not as familiar with good protein sources that are not meat-based.
No, and that's a realistic concern. That's important to bring up. So there's a lot of foods that are high in protein that we wouldn't think are high in protein, such as quinoa, leafy green vegetables like spinach, beans, lentils, and I can prepare a list and send that over to you next week with descriptions of what they are, where you can find them, and how to prepare them. So your protein needs when you switch over from meat, they'll stay the same. So you'll just want to focus on maybe if you didn't have hamburger for dinner, add beans in. So these are tiny little switches. That's awesome. You're bringing it up. And is there any other clarification you need on the protein?
I think that makes sense. I definitely would like to have some resources, just so that I can do some more research on it myself.
Yeah.
No, that makes sense. And then, so does that mean that my carbohydrate and fat needs are the same as well? Do those change at all?
Nope. So since you're just changing your diet, so your needs aren't going to change at all. You still need the same amount of fat, protein, and carbohydrates, and I can kind of write that up for you and show you next week. And I can show you some switches to make that'll make it a little easier to follow because this can feel like a big change. You're changing the diet you're used to from a child. You've grown up with it, but I feel like you are making the correct steps, and we'll slowly start to make you feel more confident with these changes.
Okay, okay. That's good to hear. That's reassuring. Thank you.
Yes.
So I have one more question. I really like to lift weights a lot, because I have a hard time keeping muscle on, and I really like to try to stay strong and muscular. So I'm just concerned with my protein supplement drinks. There are whey protein, which is dairy. Do you know, are there any non-dairy options that I could use?
There are. If you enjoy the whey protein you're drinking, the whey protein is just the protein component of milk, so you don't have all those fats that you are concerned about in it. But if you are interested, they make a soy-based one, an egg-based one, a plant-based one, a pea-based one. So there's a lot of different options, and I can read those in next week to show you, and we can do a little comparison. But know that if whey, like, don't stop using your whey protein because I know that's a huge drug. Don't just stop using it. Maybe finish it out, and if you're ready for a change, I can help you get there. But if you want to keep doing whey because you like the flavor and the consistency, that is not going to go against the vegetarian diet that you're aiming for, since you still are looking at incorporating some meat and some animal products. If we get to the point where you want to cut all animal products out, we can slowly start to transition. But I know that I've had clients in the past that they like the consistency of one protein powder and the other one is totally different. So that's going to be a change we can slowly make throughout this time, and I can bring those resources in next week.
Okay, that would be great. Thank you.
So, do you have any more questions for me or anything I can clarify?
I think that's it for today. I just need to kind of sit with it and let it all soak in. And then I will really look forward to accessing those resources.
Yes. So, kind of in conclusion, I'm going to send those resources over right after this meeting. And I think you are taking the right steps for your health. And please know this doesn't need to be a cold turkey, like no more meat, no more dairy. Like this can be a slow process. And if we reach halfway through the process and you're like, this is what makes my body feel good and makes me feel healthy, we don't need to go all the way vegetarian. We can just do it in little increments and while you feel comfortable. And as soon as it feels uncomfortable or you don't feel like this is manageable, that's where we stop or we go back a step. So I think you're making all the right choices for your health, and I'm excited to keep going on you in this journey. I will send those resources over, and I will see you next week.
Sounds great. Thank you.
Thank you.